Lysosomal storage disorder. So this is the topic. To ask a few questions, what is the enzyme defect in case of the Tay-Sachs disease? Next is, in case of Krabs disease, what is the enzyme defect? Then, what is the enzyme defect in case of the Hurler's disease? So we'll find all these answers in this video. So first, what we need to know is that the lysosomal disorders, LSD, lysosomal storage disorders, are divided into the sphingolipidosis. Next, there is the mucopolysaccharides, and next there is other category. So now jumping to the sphingolipidosis. So the sphingolipidosis, it has the Gaucher's disease. So the Gaucher's disease is nothing but the enzyme defect here is the glucocerebrosidase. Then comes the Tay-Sachs disease. So the Tay-Sachs disease, the enzyme defect is nothing but the hexoaminidase A. Then we move on to the Fabry's disease. So in case of the Fabry's disease, so Fabry's disease is nothing but it involves the alpha galactosidase. This is A. Then jumping on to the Krabs disease. So the Krabs disease, it involves the galactocerebrosidase. It is nothing but the galactosylceramidase. Then comes the Niemann-Pick's disease. So the Niemann-Pick's disease is nothing but the enzyme defect is the sphingomyelinase. Then looking at the mucopolysaccharidosis. So in case of the mucopolysaccharidosis, it involves the Hurler's syndrome. So the Hurler's disease, Hurler's syndrome, the enzyme defect is the alpha L iduronidase. So now jumping on to the Hunter's disease. So the Hunter's disease is nothing but the deficiency is of the iduronate 2 sulfatase. Now looking at the other. So here it involves the Pompey's disease. The Pompey's disease is the defect of the lysosomal acid alpha 1,4 glucosidase. Now answering the questions we are initially asked. So in case of the Tay-Sachs disease. So the Tay-Sachs disease, the enzyme involved here is nothing but the hexosaminidase A. Then we look at the Krebs disease. So in case of Krebs disease, the enzyme defect, it is nothing but the galactocerebrosidase. That is the galactosylceramidase. The next question was what is the enzyme defect of the Hurler's syndrome? So the enzyme defect here is nothing but the alpha L iduronidase. Iduronidase. everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.